So, Dr. Daly, now breast cancer is the second leading cause of death in women, second to heart disease, and the number one cancer seen in women. You know, statistics shows that 1 in 8 women will be diagnosed with breast cancer in her lifetime. And in the United States, we have over 250 women that are being diagnosed yearly with breast cancer, the invasive type, and another 63,000 with the in situ localized cancer. Now, do we also see breast cancer in men? I know this is not your area, but do we have breast cancer in men as well?
Yes, definitely. We find breast cancer in men. 99% of the breast cancers found are in females, but about 1% is in males. Over 2,400 men are diagnosed annually with the disease, and 500 of them die yearly.
Right.
Most of these are related to genetic factors, et cetera, as opposed to women who can be of average risk or have other high-risk conditions.
Right. And worldwide, about 1.5 million women are diagnosed with cancer yearly, and about 500,000 of those will die. Now, we're here to empower women to protect themselves of breast cancer. Now, in the last several years, it is believed that the death from breast cancer has been on a decline. Why do you think this is so?
Well, a part of this is related to the screening. Early detection definitely is a must, and that has been facilitated by the use of mammography over the past few years. There are other adjunctive diagnostic techniques that are used, but in general, for women of average risk, mammography is the gold standard. And that has helped to increase detection and also overall decrease the mortality of women who have been diagnosed with breast cancer, and prevent them from progressing to higher stages.
Right. It's also believed that increased awareness also has allowed the decrease in death and healthier lifestyle, as well as treatment option. Now, the focus of the show today is on risk factors. Are you at risk? Who are the ladies at risk or men that are at risk? Let us look at several risk factors. What about age? Could you tell me something there?
Yes, well, let me just say the biggest risk factor, as I mentioned, is being female and also advancing age.
Yes,
okay?
yes.
Because only 1% of breast cancer is diagnosed in men.
Right.
Age is a definite factor, and age specifically, as you advance in age, your risks increase independent of any genetics. The earlier the onset of your menses or menarche, and the later the onset of menopause, portends greater risks for breast cancer.
Okay, now, so why is this so? So early menarche, that's the early menstruation age, and late menopause. But why is this so?
There's a long interval of exposure to estrogen.
Right.
And estrogen is thought to be the causative agent that stimulates or is particular to women. Not just particular to women, because the men also have estrogen, but that is thought to be the overexposure to continued cycles of estrogen is thought to increase the risk of breast cancer.
Anything else?
In terms of age,
Yes.
age of the birth of your first child, again, from menarche to late age of delivery of your first child is an increased risk. I mentioned the interval between menopause and menarche and menopause. And also people who don't have children are at increased risk for breast cancer, again, because of the extended period of estrogen stimulation.